A $1.1 billion class action lawsuit in Canada is targeting more than 24 pharmaceutical companies. The suit, filed yesterday, accuses multiple companies, including embattled drug maker Purdue Pharma, of promoting addictive opioids despite allegedly knowing their risks and manufacturing an opioid crisis that killed thousands in the process. It comes the same week as the Attorney General of Pennsylvania sued Purdue Pharma for allegedly using deceptive marketing tactics to sell opioids. The suits are two of some of the 2,000 cases that have been brought against pharmaceutical companies for their roles in the ongoing opioid crisis. Let's get the medical and legal take on all of this with Morning Joe medical contributor Dr. Dave Campbell and State Attorney for Palm Beach County, Dave Aronberg. You guys were actually speaking on this issue yesterday. Dave Aronberg, on the legal front, is this is it fair to blame the drug makers for something that people then take themselves? I mean, where's the connection, I guess, between the crisis and the companies that make the drugs?
Yeah, hi, Mika. Well, this epidemic was man-made and years in the making and created by corporate malfeasance and professional greed. And so the drug manufacturers and distributors should be held accountable. I mean, OxyContin came out in 1996 and was billed as being safe and non-addictive when it was neither. Now you've got millions of Americans addicted to this stuff, and the corporate America needs to be held accountable for their role in this. And by the way, now it's a fentanyl epidemic. And the top thing we can do on it is to get tough with China, which is the leading exporter of fentanyl into our country. And as we're going through these trade talks with China, that should be at the top of our list.
Absolutely. And Dr. Dave, I mean, is it possible these drug companies had no idea that these drugs were highly addictive and could destroy lives?
No, I think that's unlikely. I think they more likely knew and were effective in their marketing techniques to doctors like me that were actively practicing in all types of fields, from trauma surgery to orthopedic surgery and pain management. So there certainly is some culpability there, but we have certainly evolved from the pain pill epidemic to the heroin epidemic, now to the fentanyl epidemic, and the CDC reports this week we have to start watching cocaine and methamphetamine and these psychoactive substances. This is an evolving crisis.
So medically and legally, Dr. Dave and then Dave Aronberg,
yes.
How does this compare to cigarettes in terms of the addictiveness of it and the knowledge on the part of the drug maker?
Let's look at the death rate. There's 480,000 or so deaths from tobacco, 80,000 or so deaths from all substances. We almost hit 50,000 deaths a year with opioids. So, in my opinion, tobacco is dramatically more harmful. And we would have to go way back to link the tobacco knowledge, which was done 50 years ago, to the health risks that were known for a long time as tobacco was and remains sold.
And but Dave Aronberg, there obviously are parallels between what the tobacco companies knew in the 50s and the 60s and what opioid companies knew in the 90s. The corporate malfeasance does share. There are a lot of similarities between these two industries, right?
Exactly. And the lawsuits that were successful against the tobacco companies will provide precedent for lawsuits against the pharmaceutical companies when it comes to these opioids. And unfortunately, I think that the opioid companies, the pharmaceutical companies that are on the hook for their opioid sales, will follow the lead of the tobacco industry and export our addiction to the rest of the world. Remember, after the tobacco companies were sued successfully, they then started selling their product to the rest of the world with extra aggressiveness, and it made them billions of dollars. Expect to see the same thing happen with the opioid manufacturers and distributors. Right now, this is an American problem. Unfortunately, it's going to be the world's problem pretty soon.
So, Dr. Campbell, we're talking about the pharmaceutical companies. There's a big step, though, between the pharmaceutical company and the patients, and that is the doctor. What responsibility, what culpability have doctors had over the last decade, say, in overprescribing opioids?
A couple different areas to think about. Most doctors have been very thoughtful, compassionate, and provided health care. When pain needed to be treated, they treated it. The outliers, perhaps, were prescribing more than they should, knowingly. The vast majority of doctors, this caught us by surprise.
There's one other thing
All
that
right.
seems to have caught people by surprise, and the way this epidemic has hit women specifically. Can you go into that a bit?
20 years ago, the numbers were dramatically different. It was a male-dominated epidemic. Those numbers have shifted now 400 times increase in women being addicted. And
400?
Wow.
yes, now we see that with fentanyl, surprisingly, that number is changing. So more men than women. I think the numbers will confuse us a little bit, though. If we think about the effect on women, there are a lot of social issues, family issues that are not the same. Women have responsibilities that are different. Take one, for example. When they go to rehab, they need childcare. So they're less likely to go if the rehab facility doesn't have childcare. Most men won't think about that.
Wow. All right, Dr. Dave Campbell and Dave Aronberg, thanks to you both very much.